Dr. Daniel Bloomfield, Dean of the School of Basic Medical Sciences and Clinical Medicine at Urbana-Champaign. Today we're privileged to talk with Dr. Arthur Grohman, visiting professor, or I should say distinguished visiting professor of pharmacology and medicine at the School of Clinical Medicine at Urbana-Champaign. Dr. Grohman began his scientific and medical career over 50 years ago. He received a PhD in chemistry from Johns Hopkins University and followed that up in 1930 with an MD degree. Since that time, he has practiced and consulted in a wide variety of medical areas. Over the years, Dr. Grohman's practice and beliefs in medicine have evolved into what he refers to as the art of medicine. Dr. Grohman's scientific degrees and his many awards and articles support these ideas that we're going to talk about today. With his busy schedule, Dr. Grohman remains very active in medical education today and in medical practice. He has spent the 1978-79 year as a visiting professor in our school. Dr. Grohman, to begin this discussion on the art of medicine, I'd like you to expand on that idea. You've long held the opinion that there is such a thing as an art of medicine, and to practice this art takes keen observation and logical synthesis. That may have been true 50 years ago when you began. Do you think it's still true today when doctors have the advantage of technological tests to help them with diagnoses far beyond anything you ever dreamed of?
I think Dr. Bloomfield is actually more pertinent today than it ever was in the past. With the multiplication of our knowledge in medicine over the last 50 years, it's certainly increased what we have to know today as opposed to what was ample knowledge 50 years ago, has increased at least 100 times, while it is more desirable than ever to have some method whereby one can rely on thinking and observation and experience rather than merely the multiplication of facts and obtaining data from laboratories, which in no case can substitute for the physician's knowledge.
How would you define the art of medicine?
I would define it as the ability to utilize all the senses used, which means physical diagnosis, observation, an ability to correlate these facts in terms and to apply intelligence rather than a cookbook approach of taking facts and trying to get the result. If one were to rely on the other, we wouldn't need a doctor with the various complicated machinery that we have. It would suffice to use a dispenser whereby you merely touched and put in your symptoms, put a coin in, and pulled out the diagnosis. Walk to a second machine, put the diagnosis in, apply the coin, and get an injection if you put the proper part of your anatomy against the machine, and that would be your treatment. Unfortunately, I think the failure of modern medicine with its complications is due to this approach, which has been jocularly, but actually very truthfully said, that the laboratory makes the diagnosis and the detailed man prescribes the treatment.
Do you find that today's doctor is much different from the doctor that existed when you graduated?
Very much so, yes, sir.
In what way?
Well, in the first place, he never goes to the home to see the patient. He doesn't spend the time with the patient. He relies entirely on laboratory procedures from which he draws his conclusions, and then he has available detail man who's merely doing what he's being paid for, but the advertisements, including the TV advertisement, which tells him how to treat.
Are you saying that the art of medicine involves much more doctor contact with the patient, both not only in the office but in the home?
Absolutely. Not only in the office, but by a very careful attendance and noting, using observation as well as the physical methods, and following the patient and being able to coordinate this information, which tells him lots more than a misleading laboratory procedure, which often, since he doesn't know the details of this, may actually lead him astray.
Can you give us some examples where, when the art of medicine is not practiced appropriately, that people are led astray?
Well, yes, sir. I think that's very commonly. One, for example, will run a battery of tests for thyroid. They'll come out to suggest that the patient has hypothyroidism. They'll lose their thyroid gland as a result of that, rather than merely observing it. As the late Dr. Means said, you can make the diagnosis of hypothyroid condition over the telephone, listening to the patient, observing how they look when you approach them. For example, a hypothyroid patient practically meets you at the door. The neurotic individual turns his face to the wall and says, come and get me. And whereas the lab test for T3, T4, and the product thereof and division may mislead you because there are many factors, a dozen at least, to give you a misleading result. They're not looking at the patient, not listening to him, seeing how he responds. Doing a careful physical has much more meaning.
How do you suggest that medical schools adapt their processes to reinfuse the art of medicine into medical education?
Well, I think you have to give up. It's impossible to acquire all the knowledge of these massive textbooks that we have now, certainly by mere reading. I think the approach that you've made here at this school is a very appropriate one. I think that the student, rather than merely giving him facts to memorize, some of which will be wrong, he should be impressed with the fact that some of this may be wrong by the time he gets ready to utilize them, rather than give him all these minutiae, to have him teach him how to think and to observe. And then he can read, the facts will fit in very nicely, rather than spend time giving him details of the material which perhaps he will never use. And particularly with specialization as it's attained now, unless he's a specialist in one of these things, he will never be called upon. And I take an example of being able to diagnose under the microscope the particular disease of a kidney biopsy. The pathologist is going to do that. So to go into this detail, no matter if he can describe it perfectly, he should know the principles of it, and he should know the basics. After all, he's dealing with a chemical machine, so he has to know the function, physiology, the anatomy to some degree, to the degree in which, depending on what later, if he goes into a specialty, he'll have to know more about that particular branch of it. And most of his knowledge is going to, specialized knowledge will be acquired from experience after he's graduated. But I think it's our duty in the medical school, 4 years training, to acquire the ability to understand the basic sciences, namely chemistry, anatomy, physiology, pharmacology, their principles rather than mere facts.
You know, there was a doctor who was famous for taking a stethoscope and putting it in a case and say, this is an ancient relic. Now, Of course, many doctors, they still carry the stethoscope, but that was a symbolic maneuver to say the observation is a technical observation of the X-ray rather than the stethoscope. How would you react to that particular type of approach?
Well, I think the stethoscope is far from being a relic, and I think merely getting a lot of X-rays at each turn, one should be able to, certainly. Well, that will be able to, perhaps by over-irradiation, will merely make the individual perhaps more susceptible to developing a cancer, which is not only, so he's violating Hippocrates' principle of primum non nocere, don't hurt the patient, and he certainly should be able to diagnose pneumonia, a fluid in the chest, and other things. The X-ray is useful, and certainly there are certain lesions that he might not pick up. But unless those are indicated, routine studies are utterly potentially harmful, and certainly don't add anything.
Well, we get patients are admitted to hospitals for diagnostic problems, some of which are associated with symptoms, and almost routinely get a series of X-rays of the chest, stomach, gallbladder, bowels, and a battery of chemical tests. What do you think of that type of approach to the symptomatic patient?
I think it's entirely wrong. I think that's what's caused certainly the economic problems that we have now as regards medicine. It's increasingly everyone, including the Washington representatives and the hospital costs, and much of that is brought on by the fact that with insurance, Medicare, and Medicaid, the patient making the great mistake of thinking that he has to utilize these, and the doctor utilizing them. It's a great waste, not only economic waste, but actually doesn't do the patient any good.
You have taught a great deal of pharmacology. This year you're a professor of pharmacology at the School of Clinical Medicine. Do you have any thoughts about the modern student, the modern doctor, his approach to pharmacology, the basic principles of drug therapy, how to stay out of trouble?
No, sir, I think I do have some opinion about it. I think it's one of the poorest specialty or branch of medicine as it's being taught now, Dr. Blumfield. I hate to say that, but the reason for it is not far to seek. All of the drugs that we use now have been developed during the past quarter of a century. At the beginning of the century, as Roessler pointed out, there were only 4 drugs that were worth. Prior to his time, Oliver Wendell Holmes said if he threw all the drugs in the pharmacopoeia, and they had lots of them, but they were more or less innocuous, into the sea, due to the harm of the fishes and to the welfare of mankind. And today, we have so many, and they're all, and many of them do a terrific amount of harm. Over half the instances of so-called malpractice suits are based on the misuse of drugs. So that's a terrible reflection.
Would you say that the malpractice, therefore, is the tip of the iceberg?
The tip of the iceberg is showing where the money is for the lawyer and where the harm is being done by the physician. Now and there's many, they're doing a tremendous amount of harm. So that we're getting to the point, going back as far as Voltaire, who made the point that the doctor is a little man in black who's taking substances, drugs, of which he knew nothing, and putting them into a body of which he knew less. And we're making retrogression rather than not to say that the drugs are not important. They're a miracle And when we consider you don't have to worry about your child having polio and diphtheria, no longer need you be like Sophia Luke, who was being worshipped by the parents of the little girl, the little child who was dying of diphtheria. That was all. It's wonderful, but like all other benefits of mankind, there's a penalty that we pay.
I was just reading a Mark Twain account of how parents should handle their children in case of what he called something like the malignant membrane of the throat, or what it was called. And that reflects an 1870 mentality where diphtheria was a serious problem for the family to face at those points. Now, as a matter of fact, we know that this is probably wiped out as a major health problem in this country through the empirical use of pharmaceutical agents. We know, for example, we don't need an art of medicine to eliminate this. What many people are saying is there are so many things we can do automatically that perhaps we don't need the art of medicine, particularly in the pharmacological area, because the drugs are so specific.
Well, we certainly don't need any great art as far as, say, preventive measures, because these should be done by law, and the child can't go to school in most areas unless he's held protected. Those are routine. They're very simple, and the public health nurse could handle that. You certainly wouldn't need a physician. But thereafter, man, unfortunately, again, as I said, was the only animal that loves pills. A little infant would be able to search out in his mother's purse and find enough iron pills that she has there to kill himself with it and poison himself. No other, none of our so-called lower creatures would do a thing of that sort.
When you see students, do you think they have the understanding of how much man and patients love pills? For example, in an office practice, I saw so many people come in, and if you didn't give them a pill, they were absolutely disappointed, and you had the feeling they'd go to somebody else.
That is certainly true, Dr. Bloomfield, and I've encountered the same things, except I make it a point of telling them that I'd be perfectly glad to give them a prescription, that the pads cost nothing, they're given to me if they want it, but it won't do them any good, and I've never seen a patient, or perhaps I haven't seen some that might not, those I just as little would go elsewhere, any of them. I think we use that as an excuse, just like the excuse if I don't do the test, I might be sued for malpractice. I think that's the physician. I think both of those I feel are false. I think the patient could be. You don't have to give him a shot of penicillin if you explain that's taking him for a common cold, or do a test and bring him into the hospital for a test which he doesn't need. No, he won't see you for that. The receipts of malpractice that are used as the excuse are based on real, those that are won. There are some frivolous ones perhaps that are brought on, but they are never won by the litigant. But the others were never brought on except for actual malpractice, use of tests which aren't needed, use of drugs which aren't needed and which should not be prescribed.
Do you think the placebo has any role in the art of medicine and current therapy?
Well, I realize that the psychiatrists are all against the placebo. There's no denying that the placebo effect holds. That is, that regardless of what the symptom is, 1/3 of patients will respond to the placebo effect, and much of it is a placebo effect. But to utilize it, I think, except in rare cases, rarely, I think occasionally in a certain type of individual, I personally would not hesitate to use a placebo. But other than that, and certainly one should realize that much of the effect is a placebo effect. That is not to take the credit for having accomplished something when actually it's purely coincidental.
Are you involved in some of the modern pharmacology or neuropharmacology in relation to the enkephalins and the endorphins, which in a sense explain the placebo effect as those an internal opiate, as it were?
Well, yes, that I think is represents a great advance in our understanding. In fact, the great advances in handling mental and disease has come from pharmacology. It hasn't come from the practitioners of the art of psychiatry, but from the pharmacologist who has made compounds and studied, and again showing how an understanding of the basic physiology, pharmacology, and biochemistry, so in the case of the brain, is the only approach to which we'll make any advance, and which we have to understand if we're going to utilize properly.
With respect to malpractice suits related to misuse of pharmacological agents, have you been involved in any specific cases as an expert witness or something of that sort? If you give us some kind of feeling as to some examples of that?
Yes, sir, I've been involved with a number of those. I will mention just one. A patient, and working in an industry, merely bruised his knee. He sent to his company doctor. The company doctor, instead of telling him, go home, wash it, get back to work Monday, wait Friday, prescribes a drug. 2 drugs. One is not enough, 2. So the 2 drugs, which in the label on the drugs, which of course this doctor wouldn't see, the pharmacist throws that away, that's the packing, but the PDR, Physician's Desk Manual, has it with a large print. Never use these two drugs together because they give the signs of encephalitis. This man, who needed nothing but a bar of soap and to wash his bruised legs, goes home, but he takes the 2 drugs, and the next day he has all the signs of severe encephalitis. So by the Sunday, he has to be rushed to the hospital and can't get back to work Monday as he was told to. He's at a very large university hospital for 1 month, seen because many of his systems were affected. They all said diagnosed with collagen disease, except the ophthalmologist, who blindness was one of his symptoms too, noted and said possibly this may have been related to drugs he was taking. The only one. Well, this man finally ends up, and when I saw him last, he's blind in one eye completely, in a wheelchair. He'll never walk again as a result. Now that is and the doctor, of course, he doesn't pay. His insurance company will pay as much as would have to pay.
From the standpoint of the doctor who we're trying to train,
yes,
there are 20,000 different drugs in the PDR for him to select from. How would you suggest that the doctor deal with that problem of so many different drugs and the problem of dealing with those kind of things, because no human being is capable of memorizing all the side effects of all the drugs?
Right. Well, he, in the first place, should have violated what Rogers, the great Persian physician in the year 900, roughly, said, never use a complicated drug when simple measures would do. He should have shouldn't have prescribed any drug, so he was doing bad medicine. He was just showing off and writing a prescription of which he knew nothing. And that's where he was going. He shouldn't. Now then, if there was an occasion for using it before he used it, and if he didn't know that he could look it up. He didn't have to memorize. No, I think that would be like memorizing the telephone directory. You look up the person you're going to call, and if you're using the drug, you should know enough about, in general, about the relative toxicity. And if you're in doubt, look it up.
Would you say that the physician could protect himself by using a limited armamentarium drugs that he knows that he's comfortable with?
Well, I'd say it depends on his ability. If he's actually, in most cases he would, but before he uses one that he isn't, and even if he has had some experience, he can, as you said, can't know all the facts about all of them and what they. Look him up. The book is given to him free, the PDR, and he doesn't even have to buy the book. And he has it, should have it on his desk, and he shouldn't. For a common cold, before he should know that penicillin is not the standard treatment for the common cold, that most of them are virus, until he proves the organism that there is, and it's going to help him. He should always weigh the potential harm against the potential good.
You know, when students come into medical school, they come in with very good intentions. And I think, as a rule, the general intention of a service profession, a profession where they want to do their best for the patient. I think they all want to do the best for the patient. Somehow, when you describe what you see in practice, the physician in practice has lost something between entry into medical school and ultimate, shall say, performance in practice, at least in some cases. Don't know it all. What's going on? What's happening? Is this a medical school deficiency? Is this a societal deficiency? Where is the problem here?
Well, I think the problem mainly is the main deficiency in the biped's deficiency. He's not, he's faced with a complicated subject that he's incapable of dealing with. You can't find a good mechanic to fix your car, which is relatively simple. And here you're expecting thousands of individuals to be able to handle the complicated machine that we call, or that makes up a human being. And he's frustrated by this difficulty. It's so difficult that my own feeling is, there but for the grace of God go I, and it's just too much for him. It's the penalty we pay for progress. And another famous, I think it was the same Persian physician Razi said, perfection can never be attained in medicine, and experience will teach more than the books.
Would you say that's true also with respect to the art of medicine?
Oh, definitely. I don't think it could ever be perfect. I think that's asking too much of the human mind.
It'll always be a practice, then.
It'll always be a practice, but I think our only goal is to try to make it the best of that's possible.
We have a couple of more minutes, and I wonder if you're going to give some advice to a student that was coming into medicine, what would you tell them to say in terms of having them come out of this process and at least try not to be influenced by what we might call those influences which corrupt the essential element of a humane doctor?
Well, I think a lot of that has to be congenital in human. I doubt if the teaching, if you could just tell him. I think it goes more than that, Dr. Bloomfield. I'm afraid we can't. I think we can only set an example. If they're so inclined, they'll follow it. And in the teaching, don't try to merely have him repeat cookbook fashion, and I think indicating the need for what is represented as the ideal art, and make him recognize the human foibles and the inability to reach perfection. And I is all I think we can do. The rest is dependent upon the students.
Who are some of the great physicians that you've worked with and seen in terms of observations or skills of medicine?
Well, of more recent years, say Dr. Louis Hammond and Hammond-Rich disease, Dr. Rich in pathology, Dr. Welch, I was a great admirer of the discovery of the Welch bacillus, and those were Dr. Frankel, who introduced sulfancin into medicine. He was a fine gentleman, practiced in Heidelberg. Dr. Auld, Boston, I didn't know him too well, but what I know, there are a great number of great and fine physicians whom they could emulate.
Dr. Grohman, we're just about at the end of our time, but I really want to thank you for this very helpful, important document that I'd like to show to medical students and classes that we have now and classes to come to future generations. Thanks very much, Dr. Grohman.
Well, thank you for the opportunity of being able to participate in this, Dr. Bloomfield. Now, I must add, Karen, I've certainly enjoyed my year here, and my take is my motto of Samson Wright. His physiology book is still in his new edition in his long beard, current in England, is a great book. That is his introduction. It says, some words close to that effect, the cow that suckles obtains more joy than the calf is being made. Quoted from, he puts the Talmud, and which means that I've enjoyed it. I don't know whether the students have, but the teacher actually enjoys it more than the students.
Well, the students have certainly enjoyed your presence this year.
Thank you, sir.